How can diverticulitis stricture recurrence be prevented? Imagine a narrow passageway in your colon that can cause blockages and discomfort. That's what a stricture is, and it often develops as a complication of diverticulitis. When inflammation from diverticulitis becomes severe or keeps coming back, scar tissue can form and narrow the colon, leading to a stricture that might block normal bowel movements. Preventing this kind of recurrence involves a combination of lifestyle choices, proper management of episodes, and sometimes surgery, all aimed at reducing inflammation and avoiding further damage. The first step is preventing diverticulitis episodes from happening in the first place. Eating a diet rich in fiber is key. Foods like whole wheat bread, oats, apples, pears, berries, beans, sweet potatoes, and leafy greens help keep your bowel movements regular and reduce pressure in your colon. Studies show that people who eat about 23 grams of fiber daily are less likely to develop diverticulitis. On the other hand, a diet high in red meat, refined grains, and fatty dairy products increases the risk. Limiting red meat to less than 51 grams a day can make a difference. Combining a high-fiber diet with regular physical activity, such as walking or cycling for about 2 hours each week, and maintaining a healthy weight can cut your risk significantly. If you smoke, quitting is strongly advised because smoking is a modifiable risk factor that raises the chance of recurrence. When increasing fiber intake, do it gradually over a few weeks to prevent gas and bloating. Drinking at least 64 ounces of water daily helps fiber work effectively and keeps your stool soft. If you need to limit water intake, fiber supplements like Metamucil or sugar-free fiber gummies can be helpful. These promote healthy bowel movements without causing discomfort. If you do experience an episode of diverticulitis, managing it properly is essential. For in complicated cases, rest and a course of antibiotics for about 10 days usually help reduce inflammation. Older adults or those with more severe symptoms may need hospitalization and intravenous antibiotics. After recovery, your doctor might recommend a colonoscopy to rule out other issues like cancer, especially if you had significant symptoms. In cases where diverticulitis keeps coming back and has caused a stricture, surgery might be necessary. Removing the affected part of the colon, often through a procedure called a colectomy, can prevent further episodes. The best surgical approach is usually a total sigmoid colectomy with rectal anastomosis, which has lower chances of the disease returning. Minimally invasive laparoscopic surgery offers benefits like less pain and quicker recovery, but long-term results are similar to open surgery. Emerging treatments like probiotics combined with medications such as mesalazine are being studied for preventing recurrent diverticulitis, but more research is needed. It's also important to know that the old myth about avoiding seeds and nuts to prevent blockages is not supported by current evidence. These foods are good sources of fiber and can be part of a healthy diet. Most people with uncomplicated diverticulitis recover fully and can live normal lives. Recurrence happens in about a third of cases, especially if there are risk factors like family history or longer segments of affected colon. Because each person's situation is unique, consulting with a healthcare professional is vital. They can assess your individual risk factors and help develop a personalized plan to prevent future episodes and complications. In summary, preventing diverticulitis stricture recurrence involves eating a high-fiber diet, staying active, avoiding smoking, managing episodes properly, and considering surgery if needed. Always work closely with your healthcare provider to tailor strategies to your specific needs. Remember, taking care of your gut health today can help prevent serious problems tomorrow.